And for that, I would call Dr. Shafqat Khan, Additional Mission Director, National Health Mission, ABDM, Department of Health and Family Welfare, Government of Jammu and Kashmir.
Last session, and always last sessions are partially boring, partially for the right reasons because they are the last ones. But anyway, I'll sum it up very briefly. Put the perspective of healthcare in J&K in front of you, so that you have an idea as to how much success stories we have achieved in J&K over the past 5 to 7 years. And the most important and the most notable achievement which our UT has done is that our infant mortality rate has fallen almost 10 to 12 points in just a period of 4 or 5 years. And in 2017, the sudden fall was 10 points. And we reckon that globally it has not happened anywhere that your IMR has fallen down so drastically and so immediately. So, meaning that something very colossal, something very great was done on the ground by by maybe improving the health infrastructure, or maybe by putting in more human resource, medical education, more additional funds to the state of UT of J&K, and the hard work of many people together, mixed together. So, as of today, we are leading in many health indicators if we compare them with the national average. So, J&K has success stories where indicators of health are concerned. That tells about the quality of healthcare which we are giving. You know, we have 11 medical colleges. We had just 3. We had only 550 medical seats. We have 1150. We have 250 DNB seats. First time in J&K where our DNB courses have started in the district hospitals. Great opportunity which came our way. And Honorable Prime Minister, once he announced it, it was implemented, and till yesterday, 93% of the population of J&K was enlisted on the Golden Card of Ayushman Bharat Sehat scheme. So insurance triggered, along with the COVID, some digital, initiatives which need to be done. The hospitals need to be mapped. The healthcare professionals need to be mapped. COVID came in, and one of the best things across the globe was COVID. And you all remember, it was in the beginning, it was, not possible to imagine how much effective COVID would be, with such a large population. And COVID was a success story all across the globe. You had your certificate on your smartphone, you had all the information right there. And you were prompted to get the second dose and the whatever the third dose. And finally, now I think we have embarked on a much bigger journey, which is the digital mission. And in healthcare, again, if you would think 10 years back or 20 years back, you would not even imagine that your health would be on your smartphone or your laptop or on your tablet. You had these huge paper prescriptions, your x-rays, your diagnostic tests, and mostly when you would go to a doctor, you would have forgotten the old ones at home, somewhere else, you would have lost them, And history taking, guys, is very important when a doctor looks at your health today. He can have something very special to, take out of a diagnosis which was done 10 years back down the line, or an injury which you had, or some kind of an operation which was performed on you. So I think Ayushman Bharat Digital Mission will prove to be a huge game changer for the entire people of this country, a large population of people. And I assume that if everybody knows the importance, and I think an IEC is going on across the country, that everybody develops an ABHA account, and the HPR mapping is taking place, the health facilities are being mapped, and the electronic medical records, which are already existing, are, linked to the Abhas. And, swiftly, this entire turnaround will take place, and we will be able to take this forward to level next. And, we had a meeting day before with the National Health Authority saying that we can have a scan and share. You know how many queues are in the hospitals when you go for a registration. Trust me, I've seen. I'm basically from the medical department. I've seen huge number of queues, and I used to get pained by looking at people standing in a queue. How does a person stand on a queue for 2 hours, 3 hours just to get an OPD slip so that a doctor could see him? It was very painful, and I assume that these small bottlenecks of approaching the registration counter, being seen by a doctor, getting the right medicine in the pharmacy, you would not understand how much medicine does the pharmacist have in the medical shop. You would not know how much he is dispensing, where all the rest of the medicine. There would be speculations that the government hospitals sell their medicine somewhere, The pharmacist is selling them on his own clinic, but no more. He won't be able to do that because there will be an inventory control mechanism in the hospital where the hospitals will be in your muthi, in your hand. You can check them with your smartphone that his pharmacy has Jan Aushadhi, 400 Jan Aushadhi medicines, and he can't tell you to go outside into the medical shop and get medicines. So I understand that this vision which the Prime Minister has taken us on, the mission of Digital India, is one of the most robust, things we can have. And we all have to put our heads together to come and, fulfill the mission and the dream of the Prime Minister, because it is not for the Prime Minister himself, it is for the people of the country. It is for all of us. And his dream, once envisaged and fulfilled and put in purpose, would absolutely, take our medical healthcare onto a new horizon. It will bring in accountability. It will bring into, a lot of transparency and effectiveness on the treatment you are given on the entire processes which take place in the hospital. I had a small presentation on ABDM, but I hopefully know that all of you here are aware about the ecosystem, the components, the ABHA, the EMR generation, the hospital facilities. I would not dwell upon my presentation deep, but I would run it because it has been put. You can just see this is how we have implemented this government order. In the month of July we started, and we are considerably doing very great. We have around 60 lakh ABHA IDs already created, when the target is, 51 lakh. Public facilities are 100%, private facilities registered 100%, public doctors registered already is 61.38%, and the number of health IDs linked is 7953. Our 577 institutions already have HMIs, Hospital Management Information Systems, running, upscaled, and 3 modules running, and the rest of the modules are going to come up just shortly. 3 modules are already functional. Problem is, I would like to share with all of you, is that doctors, when they have an interface with a patient, they don't want to spend time doing digital, mapping and advice and writing prescriptions. So that's becoming a challenge for all of us, that how to tell a doctor either to see the patient or now medical transcription, maybe voice. I was looking at one of the presentations, I think by Cloud Strats, right? And I found that there is some voice recognition, techniques which can be used by the doctor while he's speaking, maybe, and we are transforming his speaking into the prescription. It's taken in digitally. Another way we had thought about is we had devices that you should have a smart tablet where you can write. It can recognize your handwriting and turn it into a digital, repository. So the advice comes digitally. So that, I think, challenge with the doctors, because that's the most important in healthcare. One thing is, there is the most important aspect when a doctor meets a patient. And if he doesn't go out satisfactorily, this means the entire process is a waste. So we'll have to put in that little heart to allow the doctor to put his time into the process of, interacting with the patient, and at the meantime, make it easy for him to write the prescription. Not that he sits on the laptop and then he clicks A, B, C, temperature this, scrolling up, down onto the radio buttons and whatnot. But I think these challenges are inborn. And as our friend here told, he's Mr. Arpit. Arpit said that security, we all say in all conferences, data is gold. So there is stealing also. People want to steal gold. And I think there have to be robust mechanisms in place to secure our health information. Health information would be gold. It would be platinum. It would give us an idea to look through the landscape of a country about how our human resource is. We can plan ahead of times if we have good information. But at the same time, I think, as Arpit said, we need to develop robust systems which are very secure end-to-end solutions that our health information stays safe and secure, and our patients don't have the apprehension that this information, once put on a platform, is sold, is in wrong hands or whatsoever. So with that, I think I'll take leave. I am thankful for the organizers for having me here, and it's been a very, very informative session right from the morning till now. And thank you very much all of being here. Thank you very much.